And as for the Omicron variant, many are wondering if we've peaked, and if not, when's it going to happen? News 6's Nadine Yanis spoke with health experts on the trends they're seeing.
Officials say when there's usually long lines at testing sites like we see here at Camping World Stadium today, that's an indication that there's a high rate of COVID-19 in the community. But the city of Altamont Springs says the proof is in the data through their sewage collection. They said that their latest collection shows that nearly 70% of all the people they've collected sewage from shows that they had COVID in their system.
69% of the people there were actively shedding, which means they were, to one level or another, infected at that time.
The Altamont Springs Sewage Service Area is the largest in Seminole County, collecting COVID samples from not just the city, but take a look, Winter Park, Eatonville, Maitland, Longwood, and more, showing that of the samples collected Thursday, nearly 70% of the people had Omicron in their system.
The fact that it's moving quickly may mean that we get to the spikes and the peaks earlier, and then they descend more quickly.
And in fact,
that number is not surprising to you.
No.
According to Dr. Ali Muqdad, professor of health metric sciences from the University of Washington, the peak in Florida is here.
Florida, the cases will peak on 1/9, which is already has happened. Yeah, you already peaked and you're coming down in Florida. And it peaked at 97,000 cases in our estimate, and it's coming down. They will come down as fast as they went up.
But he says that doesn't mean there's a light at the end of the tunnel just yet.
When you peak on cases, there is a delay time between getting, being diagnosed and arriving to a hospital, or even mortality. So the peak of deaths will happen later, after even the peak of hospitalization. Hospitalization are still going up and will keep going up, and then they will peak and start coming down on the 18th. Mortality will keep going up all the way till the 22nd and will start coming down after that. After all of this, January is going to be a very difficult month for many states, not only Florida.
Dr. Muqdad says it's going to be a rough January for Floridians, that into February, March, and April, things could be calming down. But he does say by the end of all of this, nearly 80% of Floridians would have been infected with COVID-19. In Orlando, I'm Nadine Yanis, getting results, News 6.